Dan, you have the opportunity to look broadly across the landscape and different tools and strategies that employers are using to help manage cost. And it still sounds like a lot to think about an employer taking on not only having the business intelligence to understand that problem, but then solve that problem. So what are the types of strategies that large employers are using to manage costs, and how effective have those strategies been?
I mean, I'll even broaden it beyond the large employers, but we generally think about it in a few buckets. Across the spectrum, there's core plan design changes that are getting more and more prevalent. We hear it from brokers, we hear it from small, medium businesses, but I think of those as there is a shift to self-funded, which everyone knows. There's also kind of the intermediate steps of moving to a level-funded plan, which has become particularly prevalent down market. We are seeing interest in things like ICRAs and MERPs down market, where simply the costs become unsustainable, and it's a way to cap those expenses and effectively shift the risk in another way over to members. That down market is probably one of the bigger things we've seen. I think the up market, what we are seeing more of is effectively messing with the network. So you can go on one end of the spectrum, you can go to a high performance network, which can be, that's a word that means a lot of different things to a lot of different people. Some can be more restrictive and be more of a narrow network. Others maybe just simply cutting out the highest cost health system in that market. As you move closer to a PPO, you'll actually see, as opposed to just cutting people out of the network, what they'll do is find different carrots to get people to where they want to go. So you'll see, like you've seen United come out with a Sure's product. They'll use copays and try and financially incent use of financial carrot to get people to steer within the network. They'll use things like navigators, et cetera. It's more soft steerage, but those have been some of the more common responses to the cost increases we've seen.
So I know you're invested in Cintivo, and I learned from Barbara and Barbara's colleague, and just to sort of segment the market in a few different ways. There's Cintivo. My understanding is that's more of a full plan replacement option. There are companies like Transcarent that have centers of excellence for different specialties. There's direct to employer, which Disney executed on in the Orlando market with a health system. So Cintivo specifically, since you're familiar with it, I think Dan raised the point about a middleman and that being not necessarily necessary. How is Cintivo different? Because to the layman, it sounds like Cintivo is just an intermediary, maybe new age. So what is that new age component that Cintivo is doing differently than a traditional insurer that is also an intermediary?
Yeah, so not all middlemen are created equal, but agree, the more we can cut them out, the better. For someone like a Cintivo, I guess the thing to think about is like, who are they competing against? Like, what are the incumbents? And if you're an employer like us, you're basically facing off against United, Cigna, Aetna, the Blues, that frankly are making their money elsewhere. They're making Medicare Advantage. And so even a large employer like JP Morgan, we don't contribute that much to their bottom line. So we get customer service, frankly, that's commensurate with that. And so some of the new startup plans, others like Cintivo, are employer only. And therefore, it's not that much different than like the other TPAs we've seen out there where they're more customizable, they're more responsive. And frankly, like we contribute more to the bottom line and we get service that matches that. So the other thing that we've worked with the Cintivo on, if you think back to what I talked about earlier about the network sculpting, we will work with, that is Cintivo's whole thing. So we launched with them in Dallas and we built a health plan around Baylor Scott and White. And so neither us nor Baylor Scott and White in their clinically integrated network really had the ability to administer it. And frankly, I don't want to deal with it as an employer. Think about the member services, the prior auth, the claims adjudication. So I need a middleman for those things, but it is a conduit for us to have a more direct relationship and dialogue with some of the health system providers in market that we want to work with.
Would you say they're more collaborative?
Yes, I would. I mean,
well,
like we're an investor on the board, so they're very collaborative. With other employers, I would like to think they think the same.
Yeah.
So Barbara, Dan says he can do all the things he said for a lot less money. You, as Disney, imagine putting your Disney hat back on, say what to Dan? Please go work with an intermediary like Cintivo. Thank you. This is what I've been waiting for my whole life. Let's get going. Sorry, you don't have the inpatient facility, so you're not a complete network, so not much I can do with you. What do you say to Dan, who has all that value to offer you?
Oh, gosh, you have way too much information. Hey, Dan, I have heard about Dooley, and I hear you guys do a really good job in controlling costs. And we have got a slug of people in Chicago. We have 20,000 people in Chicago. And I'd like to find one partner that I can go direct to. I'd like to come up with a total episode of care, including drugs. And we'll decide, you decide what that total episode of care costs you. I know what it costs you already because I've got claims that you're going to agree with. We'll come to agreement and we're going to give you an annual increase every year on top of that. But I really need you to give me a productive employee. I want those, I could tell you everybody who's at risk, what the risk status is. I want the low to stay low, and I want the high to drop down to moderate. I'll give you a year or so to do that, but you're going to be my exclusive guy in Chicago and the surrounding areas. And by the way, you do need a hospital. Who are you going to admit to? And are you interested in that deal?
Yeah, I mean,
I know if that's what you wanted, but that's.
So a couple of things that I want to point out to all of you, and you heard it from Dan. You're a subprime lender. Well, who has an MSO? You're a subprime lender because we're shifting those collections to you. So just think about that. It all sounds good. Oh, we're moving more over to the patient, but that collecting from that patient is more difficult than it is to necessarily collect from the insurer. So I want to point that out, that like it puts even more stress on the physician groups. The other thing that, and again, I'm all about, we moved our TPA. We were with Blue Cross Blue Shield. We were with United before that, but we needed transparency. And the things that Blue Cross Blue Shield wouldn't do, we could not get our data. We were only allowed to audit 300 claims, only allowed to audit we could only audit, right? This is nuts. And then we couldn't direct care. So we couldn't say like, wow, we've got a high performance network, but you're not allowed to send them there. I mean, this is how insane it's gotten. And then the other thing they do, and I don't know if you all are familiar with this, they use a thing called a charge master. Is that everybody? It's fake. Totally. This number, I got you 50% off the charge. It is a fake number. So it's unbelievable, right? What they've gotten away with. And, we're $100 million account.
I want to keep it positive.
I am positive. I'm saying
I want to. I don't know.
We're moving.
So much
But
opportunity.
if we can't bridge to how to move forward with what foundation you have and how that's applied to Disney or JP Morgan, then we haven't advanced that, narrowed that gap. So I want to try to narrow the gap. Soon we're going to bring in David and Hopco, but we'll get there.
David.
So what do you have to say? Because it sounds like, again, there's this gap. So now back to the employer side. What tools in the market, what strategies, what advice do you have to Dan? Because what I hear is still lack of data. So maybe he can't address all.
I'm talking about my own employees.
Your own employees.
Yeah, this is not, I'm saying, listen, guys, I've got 11,000 people that receive because of we're a reasonably good size employer. And the reason I'm saying this is I'm playing both sides of this. Yeah. I'm going to reduce that number from 100 million to 80 million next year. And we're going to reference-based pricing, right? We've already done it with the PBM. We've got a totally transparent PBM now. And my other point is, and you know this, like the CEO and CFO have to be involved here. This cannot be left up to your human resource.
Let's say you get that transparency, because Barbara at Disney found a way to get that transparency. So let's assume that you found that on your employees. We're still left with Dooley as a service provider. So how do we narrow that gap between the employer side and the provider side? Is that where Cintivo comes into play?
It can. I think the biggest question, at least one of the biggest questions, is how do you actually integrate that portion of care into the broader ecosystem that employers are offering? So if you think about the plate of problems that you have in terms of if you're a benefits leader on the medical side, the pharmacy side, the different contracts you're monitoring, like I would want to bring a high quality provider who I can negotiate directly with into it. But the devil's in the details about how do I actually do it and how do I administer it? And so if you can have that hashed out ahead of time and actually think about how to bring it in, you're steps ahead of the game.
And I think there are ways to do it, Jason. I think your point is very well taken. There is a range of possibility. And I'll put Disney and our deal in Florida at the far end because it was full risk for everything. And then on the other end, in Burbank, we wanted to strike a deal with a medical group that was across the street from the studio lot. Cigna told me no. I really like that when the carrier tells you no and you're paying them. It's like, what? And we said, well, fine. We're going to do a little side letter with this group that set out certain customer service standards for our executives that were going across the street and that I wanted to introduce to really value-based care. So that was kind of a first step. Memorial Care in Los Angeles has got a deal with Boeing for El Segundo, so just for one geographic center. Or, I mean, there are just so many options if you're willing to go out into the community, talk to employers, find out what they need. And perhaps what Dan has said, maybe in one market, you want to try to do something with, a Cintivo-like entity, or band together with other employers, which is what also is being done in Silicon Valley, who are building on-site clinics where it's shared by multiple employers. I mean, there are a lot of options.